Surprisingly, at the age of was 29, coming on 30, found a lump in my left breast, with no history of breast cancer in my family other than my mother-in-law, which obviously is not of sort of direct line of family history. So I went to see my OBGYN, had a biopsy done, and came to find out that I had breast cancer. Just happened to be 5 days after I was turned 30, and also 5 days before Christmas. I sort of went into sort of immediate, sort of mode, coming from a family of physicians, actually, wanting to sort of get answers. And having my mother-in-law having gone through breast cancer, and having used Dr. Yielding and HOAA, it is my first call. It was a Friday afternoon at, I think it was about 4:30 in the afternoon when I got the results, and within 2 hours I was on the phone with Dr. Yielding. Just because I'm a very pragmatic person, and I went through an emotional stage for about 2 hours. I mean, I continue to have emotions and still do, after about everything that I went through. But really felt that, I wanted to start getting answers, especially given where we were in, approaching Christmas. I wanted to go into the holiday sort of knowing what I was dealing with and what the plan of action was. So I talked to him on the phone, and he said, I'm actually on call. I'd be happy to see you in the office on Saturday. Come in, let's do an exam, let's see what we are dealing with, and then beyond that, we'll get you in the office, a regular clinic visit, get you in for some tests, and hopefully have an answer for you before Christmas Eve or on Christmas Eve going into the holidays. I mean, in a line of work that I do, I actually have conversations with folks that are dealing with actually lung cancer, and one of the struggles that I hear from them, obviously my story is obviously of different nature, but it's still the cancer story, and some of them have to wait a month, 6 weeks, even after they've been diagnosed, even start treatment. And I think that's absolutely crazy. And I think, being able to, especially around the holidays, I mean, they really made me a priority, and said, we want to handle this, and we want to start talking about getting treatment for you. And I think that's just so important. It's important not only for the patient, it's important for the caregivers and the family and the extended family and friends, that are going to be fighting this battle with you. And I think it really just, it helps not only from a physical, sort of an emotional standpoint for the patient and the caregivers, but I think also from fighting the disease, it's important to, let's hit this as soon as we can. Every physician in my family, my father, my husband, my father-in-law, my aunts, my uncles, and my brother, and my sister-in-law are all physicians, all wanting to know what's the plan. So, being able to email him, ask him questions, and for him to even open the door for my family to email him, to call him and ask those questions, was really important. I think one thing that I really wanted to do, and I think that HOAA really pushed, was we need to take care of this. We need to not delay, and we need to move forward. And that's what I was interested in doing. And so I had 100% confidence that what the treatment plan that they had laid out for me was what I wanted to do. I think, one thing, just sort of thinking through the whole process, and even to this day, I think one thing that HOAA really does well is empowers the patient to feel like, number one, to understand what they're going through, but also empower them to fight this disease. It's not just something that, it's just the treatment that's going to solve it all. You have to have that positive attitude, and I think Dr. Yielding and his staff really instill that. It was a very personalized experience, and they're always very quick to respond to any question, whether it's by phone, if you're calling the nursing line, or even by email. Always the staff, in addition to Dr. Yielding, just always very responsive. You feel part of their family with the staff and the physicians as being a patient.
Very good.
I would say he's the most caring and compassionate doctor you can find. He really, truly values you as a patient and as a person. I think patient probably isn't the right word, but as a human being.